of the following is the most likely cause of his symptoms? Bronchiectasis, emphysema, interstitial lung disease, pneumonia, or PE. A 40-year-old man with a history of CML presents with shortness of breath and dry cough. He was treated with busulfan for his CML 2 years ago. And on physical examination, his breath sounds are reduced bilaterally. PFTs show a reduced total lung capacity and reduced FVC and a normal FEV to FEVC1 ratio. Which of the following is the most likely cause of his symptoms? Okay, I'm going to go ahead and get rid of bronchiectasis, emphysema, and pulmonary embolism. Those are all obstructive diseases, and what we're dealing with here is restrictive lung disease.
So you said bronchiectasis, emphysema, and what else? You can
PE, E.
Okay, good. Okay.
And so my initial gut is just interstitial lung disease because I'm pretty sure it's like I know busulfan and like other diseases like methotrexate can all cause like I think it's pneumonia. I think it's interstitial lung disease. They just all like it's almost like it's a memorization, like a fact. Like this is just you have busulfan. It's called busulfan lung,
Okay.
and I think it's interstitial lung disease. I could be completely. I think that's right. I think that's right.
Okay. Final answer.
Yes.
Okay, good. So only thing that I would say here, I think you worked this beautifully. Anytime you get this kind of question, especially when they're talking about total lung capacity, FVC, FEV1 to FVC, you got to be thinking automatically, right? You're in the mode of obstructive versus restrictive lung disease automatically. Okay. That's how I want you to get in this zone here. Okay. And then you talk about risk factors and things like that, right? Obviously, right. You cannot have, usually what ends up happening if you've noticed with these kind of questions, they'll give you 4 obstructive, 1 restrictive, right? Or the reverse, right? So it can't all be obstructive. It can't be all be restrictive, right? And so the odd man out or the odd duck out here is going to be your answer choice. But you worked through that beautifully here. The only thing that I'm going to say is, I want a little bit more confidence, right? You had all the knowledge, right? Don't talk yourself out of an answer choice, okay? Be confident, right? Tell yourself, okay, it's restrictive lung disease, taking busulfan, right? You're going to get a restrictive lung disease when you get chemo, radiation, things like that, right? And so best answer here is going to be C. Pneumonia doesn't really make sense here if you, right? It's going to,
It doesn't. It really doesn't.
Yep. Pneumonia doesn't make sense, right? Fever, right? Not hacking up some blood, right?
Exactly.
Things like that. So, and of course, think of it, they're not going to give you all this random stuff just for it to be pneumonia. I know that sounds weird, but yeah, you got to.
No, it's true though. It's
Yeah.
true.
All right. Let's go to the
Okay.
next.